I would like to ask then, how has your understanding of ADHD in adults evolved through the years of your practice and clinical investigations?
Yes, well, we can starting saying that adult ADHD is actually a relatively new concept as we know it. So ADHD historically was thought to be something that would a child with ADHD grew out of it by adult life. So what has changed in the probably last 30 years is there have been changes on many levels. First of all, there is the awareness of the fact that in fact 60-70% of people, of children that have ADHD, they are going to continue manifesting symptoms as adults. Another change has been, well, we call it ADHD, attention deficit. Reality is that research shows that it's not necessarily a deficit of attention, but a difficulty in regulating it and regulating it. And we have a lot of evidence through we have grown in terms of genetics. We know that it's highly transmitted through your children, and we also know other things. For example, that ADHD is very rarely on its own. Most likely than not, there is some comorbidity.
There's a certain degree of comorbidity.
And when I say comorbidity, is to explain the word, it means that there are other conditions associated, very often mood disorders or anxiety disorders. And again, what is different is probably clinicians like me, psychiatrists like me, we didn't have specific training on ADHD 20 years ago. It didn't.
So recently.
Exactly.
Yes. And I think the percentage of comorbidity is very, very high. It's about 75%, if I remember correctly.
It's extremely high, particularly for mood disorders, which in fact explains why most of the patients are going to present with possibly other associated symptoms or with a long history of comorbidities over life.